Good evening and welcome to the COVID-19 update on Channels Television. I'm Millicent Nwaka. First, the highlights. Oyo State Governor Seyi Makinde gets first AstraZeneca jab alongside members of cabinet as frontline health workers in Zamfara State take their turn. Public secondary schools across Bayelsa State receive solar-powered water facility and other items to combat COVID-19. And the European Commission proposes tougher controls on COVID vaccine exports following accusations against AstraZeneca of failing to honor its contract to supply EU countries. Today is the World Tuberculosis TB Day, marked on the 24th of March to raise public awareness about the devastating health, social and economic consequences of TB and to step up efforts to end the global pandemic. The theme for this year, according to the World Health Organization, is "The clock is ticking," which conveys a sense that the world is running out of time to act on the commitments to end TB made by global leaders. According to the director of WHO's Global TB Program, COVID-19 has intensified the disparities in living conditions and ability to access services both within and between countries. We must now make a renewed effort to work together to ensure that TB programs are strong enough to deliver during any future emergency and look for innovative ways to do so. In the meantime, the Nigeria Center for Disease Control is also joining other bodies to commemorate the day. In a tweet via its official handle, the agency says tuberculosis is curable and preventable. The center also confirmed 214 new COVID-19 infections as it continues vaccination drive against the disease. The new cases are reported from 12 states. Adamawa State recorded the highest figure with 109 new cases, followed by Lagos, which only registered 33 cases, and Bauchi 26 confirmed cases. Other states are Kaduna, 9 cases, same with River State. The FCT recorded 7, also with Oyo State. Gombe recorded 5, Ebonyi 4, Osun 3, Ekiti 1, same with Ogun State. Recently, Nigeria has maintained a low fatality figure from the virus. However, the agency recorded 1 additional death in the last 24 hours, making the fatality figure from last night in the first in 72 hours. Till date, over 148,000 persons have been discharged after testing negative to the virus. The NCDC reported 405 recoveries last night, including 157 community recoveries in Bauchi, 55 in Lagos, 121 in the FCT, and a backlog of cases from Adamawa State recorded from March the 10th. Active cases currently stands at 11,521. President Muhammadu Buhari is presiding over the 39th virtual meeting of the Federal Executive Council at the State House. Vice President Professor Yemi Osinbajo, Secretary to the Government of the Federation, Mr. Boss Mustafa, and Chief of Staff to the President, Ibrahim Gambari, are physically attending the meeting. 8 ministers are equally physically present. There are those of Information and Culture, Mr. Lai Mohammed, Finance, Justice and Agriculture as well. The head of service of the Federation and other ministers are participating in the cabinet meeting from their various offices in Abuja. The Oyo State Governor, Seyi Makinde, and some members of his cabinet have taken the AstraZeneca coronavirus vaccine at the ESCO chambers in his office. The vaccine was administered by the Director of Primary Health Development Agency in the state, Dr. Mudashe Latunji, who led a medical team for the process. Afterwards, the governor encouraged all residents to have confidence in the system and feel free to take the vaccine, as the designated laboratories in Oyo State have done the necessary tests to ascertain the safety of the vaccines for the people. He urges the people of the state to have confidence in the process and that they can get vaccinated for free.
I think we have to show leadership. We have to let people know they have to be protected. I wanted to validate that the vaccines that we'll give to the people of Oyo State have been correctly handled.
The first phase is meant for frontline workers. Who are the frontline workers? Majorly on the line are the healthcare workers. Because if you don't take care of them, and you and I fall sick and we get to the hospital, who's going to take care of us? So let's protect them first. After them, who are the most vulnerable? People that are above the age of 50 and they have comorbidity, that they have one illness or the other. Let's consider them next. Because this vaccine is not so much in abundance, so in excess. So we have to prioritize the use and people that we give it to.
The Minister of State for Health, Mr. Loranibe Mamora, is advising Nigerians to have an open mind towards the ongoing vaccinations on COVID-19. Speaking at the commissioning of the molecular laboratory at the Federal Medical Center in Asaba, Delta State, he dismissed insinuations that the federal government may soon be compelling people to take the AstraZeneca vaccine.
We cannot force people. We can only appeal to people to take vaccination in their own interest. We go out there to let the people know the benefit, to let the people know why it is important for them. But we are not going to force.
Now, frontline health workers in Zamfara State have started to receive their own doses of the Oxford AstraZeneca vaccine towards preventing the coronavirus pandemic. The Chief Medical Director of the Federal Medical Center, Gusau, Dr. Bello Mohammed, was the first health worker to receive the COVID-19 vaccine. He said the vaccine is safe, urging all Nigerians to come forward and take their own doses to stop the spread.
Gusau, the Zamfara state capital, hosting 126 frontline officers from various agencies in the state. They are here to be administered with the AstraZeneca vaccines alongside some residents of the state.
I'm thanking the federal government for considering the frontline health workers as giving them the priority so that they come forward. They are the people at risk. They are the ones seeing the patient 24 hours.
The man overseeing the exercise and the Chief Medical Director of the Federal Medical Center, Gusau, explains why it is necessary to have the health workers vaccinated themselves before administering the same to other residents.
This vaccine is safe and should be taken by all health workers, simply because when there was the outbreak of this pandemic, the medical health workers bear the brunt of it more than any other person.
All citizens of the state.
Other health workers receiving the AstraZeneca vaccines and the chairman of the Nigerian Medical Association in Zamfara State, Dr. Manie Bature, and some top officials of the medical team in the state explained that the reason for this exercise is to build confidence in the efficacy of the drugs.
It's a sort of confidence building. So I would like to use this opportunity to call on people, you understand, to avail themselves, you understand, to take this. The vaccine is safe, you understand, it's very effective in terms of efficacy, in terms of prevention of deaths, morbidity and mortality is 100%.
Residents appeal to state government to do more in the area of sensitization for people to realize the importance of vaccination.
People are just living as if the pandemic is over. We're still in the middle of a pandemic, so I think they should let people know and enforce the wearing of masks, most especially. It's not a very difficult thing to do.
As more states get their own consignment of the AstraZeneca vaccines, clearly the promise of the Presidential Task Force on equitable distribution of the vaccines to the states is now being realized, and no doubt this will go a long way in flattening the curve of coronavirus spread in the country.
For more on the efforts in the state, Dr. Yahya Kanoma, Commissioner for Health, Zamfara State, joins us on the program. We'd like to thank you for joining us. I'd like to begin with my first question, and that is first by asking how the recent insecurity situation and the fight against banditry in the state, if it is in any way affecting the coronavirus fight. Dr. Kanoma, if you can hear me. All right, we're going to come back to Dr. Kanoma, Commissioner for Health, Zamfara State. But let's jet over to Bayelsa. And this is as part of efforts to alleviate the hardship suffered by local government areas due to the pandemic. 3 communities in the state, drawn from 3 senatorial districts, have been given solar-powered borehole facilities, face masks, hand sanitizers, liquid hand washing soaps and other sanitary items. The items which were presented to representatives of the schools in Otuoke, Bayelsa State, as part of the Victim Support Fund to enable students have access to potable water.
Controlling the COVID-19 pandemic begins with clean hands, and this requires soap and running water. That's why staff and students from 3 hand-picked public schools in these communities are glad to receive donations of these materials.
The borehole facility is a very good one for us. Apart from the students using it during school period, the teachers on compound can also make use of it. And we don't have to start looking for, like I said, generator to power it before we can use it.
The schools, namely Community Secondary Schools, Otuoke, Community Secondary School, Kayama, and Community Secondary School, Sagbama, got the donations from the Victim Support Fund group.
What we've done so far is to provide food, medical items, personal protective equipment, and now to more enduring interventions that would even outlive the COVID-19 pandemic lifespan, which is to go to indigent communities and households across the country and provide them access to water facilities, hygiene and sanitation consumables.
It goes without saying that government is impacted by the school's gain.
Water is what we cannot do without. And to support us with such a wonderful project, we are indeed very grateful.
Apart from the solar-powered borehole facility, the group also donated 4 hand-washing stations, reusable face masks, cartons of bleach and other items.
We have more stories on the COVID-19 update when we return. Please stay with us. Welcome back, and we take you to the United States. We're seeing latest updates from the country, which is, of course, the top country with a lot of cases of COVID-19 and also seeing a larger number of deaths than any other country across the world. Takeaways from what we're getting, stories from the US also shows that health officials are saying that AstraZeneca may have released outdated information from its vaccine. Some of the things we saw yesterday, a lot of people are reacting to that. Also, Texas and Georgia, we understand, will be joining other states in expanding its vaccine eligibility. But joining us right now is Dion Ibekwe. She's a medical doctor, Bloomington, Illinois, in the US. She joins us now via Zoom. Thank you for joining us on the program. All right, Dion, let's quickly ask, and this is with states in the U.S. pushing ahead with expanding COVID-19 vaccine access and then rolling back restrictions on businesses and large gatherings as it seeks, return to normalcy. Experts are saying 2 barriers stand in the way of reaching herd immunity and getting back to life as before. One is the virulent variants, and then the second, the pace of the vaccinations. Do you agree? Well, we appear to be having audio issues. We'll probably try to work on that very shortly. But let's bring you the global updates. And this is as the European Union is putting forward proposals to tighten controls on the export of COVID vaccines amid a row over supplies. Under the plans, any shipment of vaccine will be assessed on the country's rate of vaccinations and vaccine exports. But the European Commission has denied that stricter controls amount to an export ban. Take a look.
Take your questions. Let me remind you that today we have...
European Health Commissioner Stella Kyriakides says the pandemic is getting worse in many European countries, with the number of COVID-19 infections, hospitalizations and deaths on the rise. In response, the Commission says it is tightening rules for exports of COVID-19 vaccines made in the EU.
The revision of the export transparency mechanism really does come at a time with the situation remaining alarming in many member states. We are starting to see more and more concerning circumstances. This is evidenced by the fact that 19 countries are now reporting increasing case numbers. 15 member states are reporting increased hospital and ICU admissions, while 8 member states are now reporting increased number of deaths.
German Chancellor Angela Merkel has ditched a plan agreed on Tuesday for an extended Easter lockdown to try to break a third wave of the coronavirus pandemic. She apologized to lockdown-weary Germans after the hastily conceived plan triggered a huge backlash.
Just to be absolutely clear, the idea of an Easter shutdown was created with the best of intentions, as we urgently need to stop this third wave of the pandemic and find a way to reverse it. Nonetheless, the idea of a stricter Easter shutdown was a mistake. There were good reasons, but was not doable in such a short time. It's not clear whether even if we had had time, it would have justified the time and effort to enforce it.
Ms. Merkel's comments come against a backdrop of growing public frustration with the Conservative-led government over the slow rollout of COVID-19 vaccines and extended lockdown measures. In Russia, the government says President Vladimir Putin has set a good example to Russians by getting vaccinated against COVID-19 and that it will get the second of a two-shot vaccine in around 3 weeks. The Kremlin says Mr. Putin had his first shot on Tuesday, but declined to say which of Russia's 3 vaccines he received. It also released no photographs or video footage of him getting the shot. In Asia, Hong Kong authorities halted the use of a COVID-19 vaccine developed by Pfizer and BioNTech as a precaution due to defective packaging, triggering scenes of confusion in inoculation centers across the city.
Just waiting around now, just lack of communication from anybody, whether on the news or people in there. Just waiting for, I've got nothing else to do right now, so I'm just going to wait for a little bit and see what happens.
The government later issued a press release clarifying that the vaccine will be put on hold pending an investigation into possible packaging defects related to the closure of bottles. The suspension comes as the Asian financial hub has faced a slow take-up of vaccines due to dwindling confidence in China's Sinovac biotech vaccine and fears of adverse reactions.
Well, from the global scene, we'll come back to Nigeria, and this is the latest vaccination updates we're getting from the National Primary Healthcare Development Agency, and that is as at March 24th today. You can see there total vaccinated 277,458 Nigerians, which represents 7.1% have been vaccinated so far. And this is also taking the first dose of the Oxford AstraZeneca COVID-19 vaccine. And the next slide, you see a breakdown of the total states, including the Federal Capital Territory, a bit tiny there. But if you just take a closer peek, you find many of the states in Nigeria are indeed recording numbers. The latest updates of those that have been vaccinated, let's not forget that the vaccinations are in 4 stages. Some states are prioritizing frontline healthcare workers, others, of course, politicians, and then other healthcare workers, including security, those at ports of entry and the likes. Still on this total number vaccinated, you will find that states like Bauchi doing quite pretty well, 36.0%, having vaccinated a total of 28,972. Another high number, which we can also find there, is Jigawa State, 31.5%, vaccinated over 21,000 persons. Ogun State as well is catching up, 22.7%. It's vaccinated over 25,000. And this is also followed by Kwara State. It's vaccinated over 14,000. That represents 26.7% of its population. We have a number of other states as well who are vaccinating. A few of the states on this list are recording zero. We know that Abia State has indeed gotten its batch, so also Kebbi. We also know that Oyo has gotten his, and we just saw earlier today the governor take his batch, so hopefully we would record more numbers there. We also know Abia State governor has indeed taken his vaccine as well, so hopefully we will see more numbers, statistics of those that are vaccinated in their state. Same also goes for Zamfara. But so far, Zamfara, Taraba, Oyo, Niger, Kebbi, Abia, and of course we know, we've heard about Kogi State, who haven't received vaccines at all. It's still zero that it is recording. But this essentially are the latest updates from the National Primary Healthcare Development Agency with regards to the over 39 million vaccines that were received from COVAX as to the number of people who have been vaccinated thus far. Well, you're still watching the COVID-19 updates. For a better understanding of the pandemic, take a look at our website. It's channelstv.com. You will find the latest stories there, and you have Germany going back and forth with regards to its Easter shutdown. We believe the Vice-Chancellor has said that she has actually gone back on some of the measures she took a couple of hours ago. We also have other stories there on the COVID-19 updates, plus politics, business, sports, all at your fingertips, channelstv.com. We would like to apologize for the technical hitch with our guests today. Hopefully, we'll have them join us again. Thank you for watching. Stay safe. I'm Millicent Walker.